I'd like to introduce myself for those of you who don't know me. My name is Sharon Closius. I'm the president and CEO of the Valley Community Foundation, and I really want to thank you all for coming, and I am so excited for this day, and I know there's a number of you in this room that are really excited that this day is here and the official launch has happened. So let's get started. I want to acknowledge some of our dignitaries that are in the room, but they're probably going to be wandering in at the same time as things are going. But Mayor Rich Zekin, back there. Thank you, Rich. The mayor of Derby, and I'm so glad that he's here. Did Chris Bila come in? Oh, there he is. Hi, Chris. Chris is the mayor from Beacon Falls. So glad he's here. We've got a number of people. For those of you who don't know, this index is of 7 cities and towns making up the Valley community. So back, it was 1999 when the Valley first started going for the All-America City. And 2000 is the year that the Valley won the All-America City. And so when we started these conversations 5 years ago, I can't believe it's been 5 years, Laura. 5 years ago when we started talking about what is the Valley, who is the Valley, it was decided to make sure that we included Naugatuck and Beacon Falls and all 7 of those original Valley towns that said, we're the All-America Valley. And so we're very proud that this actually is that All-America City group. I'm sure that there will be more people that will be coming in that I should be recognizing, but I hate to, throw off the agenda for the day. But we did ask Mr. Bob Cinto as our host if he was available to come down and just welcome everybody. So we may do that between me and when the panel starts in. So I just want to make sure that you know that. We do have a full program. I will do a little bit of introduction, talk about the demographics of the index and a little bit of background about that and the well-being survey. And then we're going to turn it over to our panel discussion, in which we've planted a couple of questions with the panelists so that they can have something to talk about instead of this broad, big topic like education. So we kind of narrowed it down so that way we would have that funneling experience there. We also will be asking Mark Abraham. Mark, could you please stand? Would you mind standing? Mark Abraham is the data miner. He is the author of this index, along with a lot of people in this room helping Mark and Sean, who's sitting next to him as well, to say what we really want this index to read like and what we want it to be about. So Mark is going to be joining the panel discussion or the question and answer part of the meeting afterwards, so that if you have questions about the well-being survey, the index itself, like where do you get the data, how do you do this, Mark's going to be joining the panelists at that time. I cannot believe that it's been 3 years. Do you know that it's almost 3 years ago today? It was October 20th, 2016, in which we were all here. Many of us were here. Can I see a raise of hands of who was all here 3 years ago? Wonderful. I love that. That we were all here for the launch of the first community index. And like the first, this index is made up of the Community Wellbeing Survey. We participated again in the statewide Community Wellbeing Survey, which we'll go over, and community conversations, as well as all the data mining, and using the 2016 index also as a way to start pulling that trend data, which our board member, especially Lynn Bassett, Perry, who is so interested in making sure that we have that trend data and making sure that we see what's going on in the Valley and that we're making a difference. This report will also serve to fulfill Griffin Hospital's Community Health Needs Assessment, as well as Naugatuck Valley District's requirement for a community health needs assessment as part of their national accreditation process. One of the things that happened a number of years ago, I'm going to now say 5 years ago, was you and this community of nonprofits and our schools and legislators said, we really could use a one single source document. So we're all speaking from the same place so that we know what's going on. And so we took the time to say, what are those needs? Griffin had the Community Health Needs Assessment. Naugatuck Valley Health District had their accreditation and their needs assessment. The nonprofits all needed the data to be able to do their reports. The schools, of course, use a lot of data, much more in depth even than this index gets. But what's important, as you will hear today, is that the index doesn't have the answers of why is this happening. The index is to stimulate you to say, I want to do a deeper dive into that, especially when it comes into information with the Community Wellbeing Survey. It took a lot of support for us to be here today and where we are. The people in the organizations that know the importance of this data and what it means if we used it for our communities. I'd like to recognize our board of directors at the Community Foundation, and our lead, Lynn, as the chair. You're going to have to raise your hand. The Community Foundation Board of Directors has been tremendous in supporting this work because, believe me, it takes a lot of staff time and a lot of financial commitment to make sure this gets done. But they know how incredibly important it is for the Valley to have this information. So I'd like to thank our board for this. I'd like to also thank Griffin Hospital, who is a large financial supporter of this process. The Catherine Matthews Foundation has given us a 3-year grant to be able to make sure this data gets done. The Bassett Family Fund at the foundation is not only a supporter of this index, but also brings you your food and your beverages today. So thank you again. We'd also like to thank the Naugatuck Valley Council of Governments. They provided a tremendous amount of data and work to interface with Data Haven to be able to pull this all together. And you will see information in the index about the, that's coming from this Council of Governments. Now, the following people, I can't even begin to tell you. I don't think we would have an index, even if we had the money. I don't know if we'd have the index if we didn't have this incredible advisory committee that has been working not only on this index, but again, many of them were working on the 2016. We have such a strong, rich tradition in the Valley of collecting and analyzing the data in the community about the health and the quality of life in our region. And it was just incredible that we could call and ask, and people would come to these meetings to say, this is what we want the index to look like. This is how we want it to read. I'm going to tell you, when you read this index in comparison to a lot of other data research material, it is user-friendly. And that's what I think we all love about it, is that, I guess I'd be a data geek to say that I could actually sit down and just read the index. And, just to be able to get an idea of what's going on in the different areas in our community. It's so filled with data and with information. So this is a snapshot of those that were there this one day at the United Way. I think this was our final meeting of the day, and so some of you weren't in the room, but we did, in the front of the index, you'll see all the organizations that have been participating in this advisory committee. They worked on the initiative from the very beginning, both in 2016 and in 2019, and reviewing the data and the graphics and sharing their expertise about what we want this index to read like. Other members of this esteemed committee are Valerie Knight-DeGangi. Val, could you wave? As many of you know, Val wears a number of hats, and one of them is the Community Foundation's program director, but the other is the project leader for this index. And she kept her eye on the prize of getting us here today with a published piece and working with not only Data Haven and all of you, but also the printers and the publishers to make sure that it was done. And I think she's going to go and collapse after this day is done. She was just really wonderful. And right next to her is Laura Downs. Laura. Laura has been the facilitator and the project manager from the very beginning. She started with us when we didn't have that common baseline report. She pulled all the reports together, the Valley Cares report that was going on, the original community health needs assessment that Bill Pawanda did with Griffin Hospital. She pulled all those together and got us a baseline report, in which from there we built the 2016 index and now the 2019 index. And just really so great to have you as a partner through all of this. And as I said, where would we be without our data miners? So Mark Abraham, Sean, and is Brian here today? Brian is not able to join us. They worked with all of our different subcommittees to come up with our chapters, to come up with the language that was used, to really work with everybody. And it was really wonderful that you, again, worked with us in this way, because it's very different from many of the other indexes. So thank you. I think, do I want all those advisory committee members to stand? All of you in the room, give a stand up so everybody can see who you are. Come on, stand up. I know we're going to end up having half the room standing up, so. Thank you. And like I said, I don't know, even if we had all the funding, it would be hard to have an index the way we have without all of you participating in this way. I also want to do a big shout out to the rest of our staff at the Community Foundation. Besides Val, we have John and Beth and Sharon. You know, when you've got a big project like this going on, the entire staff gets involved in one way or another, and they've been really tremendous through it all. So the format for this morning's program, as I said, will be a panel discussion with our 5 community leaders. We had asked Susan Agami to be here to talk about basic needs, but she was unable. She had a family emergency, so she was not able to join us today. So we said, David, can you be a double header? So David is going to take on basic needs as well as prenatal and early childhood. So that's really great. We've told our panelists, and they are coming. I'm telling you, we've got at the end Bill Purcell. There he is. He's over there, and Pat Charmel. Has Patrick Charmel been here yet? Okay. So. I'll introduce those in a minute. But what I'm going to say is we've told them about 7 minutes. They do have a clock up there. You see the clock, everybody? They have the clock up there. I have a beautiful clock up on this podium to help us keep track of time. So my goal is to have the panel discussion wrapped up by about 9:30, 9:35. That's my goal. And then in front of you, you're going to see that we've supplied some postcards as well as a pen that we hope, if you have any questions that come up during this presentation, that you write it down. And then we're going to collect them all at the end of the presentation, and then we will be asking the questions directly to the panelists. So please, if you have any questions, just write it down so you don't forget about it. So on our panel, we will have Patrick Charmel, Griffin Hospital or Griffin Health Systems. He's the CEO, and he'll be talking about community health. We also have David Morgan, as I said, who is the CEO of TEAM, to be talking about basic needs, as well as prenatal to age 5. And then Dr. Joseph DeBacco, who is the superintendent, the new superintendent of schools of Ansonia Public Schools, if you haven't met him yet. This is Dr. Joe DeBacco. And then we have our executive director, Jessica Stelmas. I'm going to mispronounce it. Stelmagic. I always want to do something else with that SZ. I don't know why. But anyway, she is from the Naugatuck Valley Health District, and she's going to be sharing information on our seniors, which is our fastest growing population here in the Valley, and Bill Purcell, president of the Greater Valley Chamber of Commerce, to share about economic opportunity here in the Valley. And as I said, we will also ask Mark from Data Haven to join the panel at the end of this. Now, there's no way I can miss this gentleman in the back of the room, so before we get started, I would love to ask Mr. Bob Cinto to say a few words. Hello. I love what you did to this room.
Thank you very much for coming. I'm going to be less than 1 minute. So, you know, I always tell people my favorite quote from the Bible is, "What you do for the least of my brothers, you do for me." You know, and I really think that what you do here, trying to help others, is what it's all about. It's all about service of others. And you know, you invested your time to come here to be part of this. So, you know, I really want to thank you for doing that. I hope we fix the facility up. We have all new equipment, so I hope the message gets across better. And I'm very thankful that you are participating in this program. Thank you so much.
Can somebody get Bob an index as he's leaving? We are very picky about how many people get the copy of this index, so I'd like to make sure that Bob does have a copy of the index. So I'm going to share a little bit about the Well-Being Survey and the demographics here in the Valley, just to play a backdrop for what you're going to hear from the panelists. First, I really have cotton mouth, so I have to take a drink. So, as you know, we live in a new digital age. Data and information now are very easy to obtain, literally at our fingertips at any given time. We know we now are able to use data, analyze it, and help us with our decision making, and then take more data and analyze that as well. Now, there's hard data and there's soft data. Data that comes, both of them come from facts and figures, but the soft data sometimes comes from surveys. What do you think? You know, it's very different from you take a test, you answer the test, you answer the questions, and there you have that hard data. How many right, how many wrong? But surveys tend to give us that soft data. What do you think? So both in the 2016 and the 2019 data index, we participated in the statewide community well-being survey. And so to talk about this data, you have to have a statistical number. So statewide, there were over 16,000, right? 16,000 responses to the survey, live answers to this question. We asked Data Haven to make sure that we had a statistical value for the Valley, which translated into having 1,044, I think it was, 1,044 here in the Valley to make sure that we had a statistical sampling. So what our goal is with analyzing the data is you have these 3 different components: the community life, the health outcomes, and the employment and basic needs. Put all that together and it's going to give you the personal well-being. Our data, hard data, doesn't tell us how happy people are, how satisfied people are, what's their quality of life. Why do they choose to live here in the Valley versus another city or location? What is that reason? So all of you in government, you want to pay attention to the well-being survey. What do people feel about your communities? Are they happy to be there? So with the one thing I wanted to add too is that the United Nations has identified measuring local well-being as a global priority. It's not just about that hard data. It is about getting the answers. The biggest challenge, and we've talked about with Data Haven, biggest challenge is getting people to answer the doggone phone, right? Because they don't want to answer the phone. They see this number come up and they don't want to necessarily answer the phone. So it took a lot of work to get this statistical sampling. And when we say statistical sampling, it's plus or minus 3.4 percentage points of if you were to conduct this same survey and asked this random group of people, random, right? Right? Random group of people, you're going to get the same answers, plus or minus 3.4%. So that's a big deal. It took a lot. It took, I don't know how, summer, right? More than the summer? 10 months to get all of this data together. And this data is available for you out at Data Haven's site to be able to see all that raw data and be able to cut it in all different ways. So throughout the state and most of the Valley, personal well-being has actually worsened since 2015, with the measure of life satisfaction declining the most. That's one of the questions that's gonna, let's go where John is. One of the questions. These are the 4 questions for evaluating the well-being. These 4 questions of, how would you rate your overall health? How satisfied with you are with your life these days? Overall, how happy did you feel yesterday? They seem very ambiguous, right? And so you get all of this data together and you start taking a look across the board at what this information is. When we look at the well-being index score for the Valley, which is the integration of these 4 questions as a whole, it's very similar to Connecticut. But as we dive deeper, and this again is what we're talking about with this index of what are you going to do about it, right there, we're roughly on par with Connecticut. But when we dive deeper and we look at the data by sex, I wonder why that is, right? When we take a look at age, that's interesting, isn't it? Our seniors, 65 plus. Is it because they're in retirement? And these guys have the young families? What is it, right? What happens if we divide it by assets? Of all of the indicators, our financial health is the lowest scoring one, 30,000, and below had the lowest score of their well-being. One of the things that all of you that participated in this data and participated in getting this index together said, you know what, we don't want to hide the disparity that's here in the Valley. We don't want to sugarcoat it. We can have our promotional materials saying how wonderful it is to live and work here in the Valley. But this index needs to be honest, it needs to be forthright, so that people can start addressing if there is a need. Data gives you needs and opportunities to work from. And without it, you're just going along in your daily way. So what we hope is that, as we have the panelists, I'm going to tell you we're not going to sugarcoat. We're going to say things. And I want you to know that it's just because that is what the advisory committee wanted to make sure that we did, is to inform people of what needs to happen. Because we can talk about the great things, but we also need to make sure people are knowledgeable about what needs to happen. So I'm going to start with a little bit of the demographics and share with you some of the data so that you can get on with the panelists. And I'm going to refrain from commenting too much, leaving that to our panelists, and just to let you know that when it comes to the index, I haven't even held up this beautiful index yet. When it comes to this index, there's so much data that when I was trying to say, okay, what are some of these points that we want to make in demographics, or what are some of the things that we want to make sure our panelists touch upon, it is so full of information that it's really hard to figure out and to select what it is. So I'm just going to start kind of at the top and just know that there's even more that there is. So the Valley population has increased by 12% from 1990 to 2017, bringing the population up to 140,243. The population growth is very uneven across the different age groups. In the Valley, a lot of different age groups in the Valley, and between 2015 to 2035, the Valley senior population is expected to increase by 39%. That's nearly twice as fast. I'm looking at Bev. She's like, Bev Kidder from Agency on Aging is like, whoa. That's nearly twice as fast as what is projected for the state here in our Valley. The Valley has an increasingly diverse population. 1 in 3 children identified as a member of a racial or ethnic minority in 2014, which was compared to 1 in 10 in 1990. And we see this in our schools. The elementary schools are much more diverse than our high schools are. The Valley's median household income in 2017 was $74,358. That's slightly higher than the state's median, which on the surface sounds good, but let's take a little bit of a deeper dive. When you break down this data by town, we see a large gap, as you can imagine. So let me give you the tops and the bottoms. Oxford has the highest median household income. I thought it was going to be Shelton. Oxford has the highest median household income of $104,316. And Ansonia has the lowest at $45,563. These numbers really come into play when it comes to talking about basic needs and earning a living wage and what you need to have to be able to get by. Poverty and low income rates have been increasing across the region since 1990 and are the highest among households with children. An average of 21% of Valley residents are now classified as low income. However, this jumps to 28% for households with children. Low income is defined as people living in households with annual incomes less than 2 times the federal poverty guidelines, or $32,480 for a family, or $49,200 for a family of 4. So that's a lot of people in our communities that are living at that level. There's a lot that aren't. That's the good news. But it's the ones that are living at that level that we want to say, what can we do and how can we help? 36% of Valley households are cost burdened due to housing, which means that they spend more than 30% on housing. 17% were severely cost burdened. They spend more than half of their income on housing. And I'm going to leave it to David, I'll bet, to talk a little bit about that with the basic needs. Because what happens when you add in childcare and early childhood and food? what happens to that. These demographics just give you a little bit of a synopsis of some of the high-level data points that are influencing the quality of life for some in the Valley. As I mentioned, we will be sharing more on the negative side of this, just so that you understand the needs, because that's where we have to start spending some of our work. And, you know, I was reminded, somebody had asked me, what was the work since the last index? You know, what have we accomplished? Are we moving the needle? And it's not so much yet about moving the needle as it is about getting these conversations and getting this unified understanding of what's going on. Yes, the Valley Interfaith Council was a result of the last index, in which the interfaith community is getting together and having these deeper conversations about what are the needs in the Valley and how can we help as a group. We also have seen a lot more information coming together for a collective impact approach and saying, okay, let's get together on what are the issues. And Sharon Danowski, can you give a wave here, has been working with a lot of us in the room on a collective impact approach to talk about working with children in poverty. And we're going to ask David to talk about that in a little bit more in that discussion.